Cancer Conversations, a Harold Leever Regional Cancer Center podcast discussing all things cancer and giving you information to improve yours or a loved one's cancer journey. Today we're speaking with Yvonne Ruddy-Stein. Welcome, Yvonne. It's great to have you with us.
Thank you so much for having me.
Before we start talking about genetic counseling and testing, could you tell us about yourself?
Sure. I'm from Connecticut, and I received my undergraduate and graduate degrees at the University of Pennsylvania in Philadelphia about 30 years ago. After that, I started my practice as a nurse practitioner in New York. I moved to Georgia, moved to Washington, D.C., and finally moved back to Connecticut 10 years ago and started working with Dr. Ellen Polikoff, one of the local breast surgeons. Around that time, her partner was looking to offer genetic counseling to the greater Waterbury community, and we thought it would be a great fit for a nurse practitioner to do genetic counseling. So at that point, I started to train. I became certified as an advanced genetics nurse, and I have been doing genetic counseling ever since.
Excellent. Let's start with the basics about genetic testing. What is genetic testing?
Genetic testing is a blood test or a saliva test looking for a mutation in a gene. And if there is a mutation in the gene, it means there's an elevated risk of cancer in the person's lifetime.
Okay. How does somebody know that they would benefit from genetic counseling and testing?
Anyone who's interested in having the knowledge that they have an elevated risk of cancer or changing their management could benefit. So someone who would consider extra screening, or someone who would maybe take medication or consider risk-reducing measures to reduce their risk of cancer would benefit from genetic testing.
Great. If I was to think about in my family, what would it be that I would be looking for in order to qualify?
So the big qualifications are a family history of cancer, specifically cancer diagnosed at a young age, even more specifically, breast, colon, uterine, or endometrial cancer under the age of 50 in yourself or any family member. Any more rare cancers like pancreatic, ovarian, or male breast cancer in yourself or a family member, or any metastatic prostate cancer. That means prostate cancer that has spread outside the prostate at any age in yourself or a family member. And the other big qualification is a combination of multiple cancers on the same side of the family.
Okay, that makes sense. So I know that a person needs to have genetic counseling before testing. What can a person expect when they go for an appointment for genetic counseling and testing?
The first appointment is what I call the intake, and that's where we go over any pertinent medical and surgical history. Do you have a history of cancer? Have you ever had a hysterectomy? Have you had a breast biopsy? Things like that. Then we go over the family history. That is the most important part. And we go over both sides of the family, grandparents, aunts, uncles, cousins, and brothers, sisters, children, and parents. Who has been diagnosed with cancer, how old they were at diagnosis, and hopefully we know exactly what type of cancer they had. Then I create what's called a pedigree or a family tree so that I can see who's related to who, and are there any patterns of cancer that suggest a genetic predisposition or a genetic mutation. After we get all the history, then we talk about what testing is indicated and the pros and cons of testing so that you can make a decision about whether testing is the right thing for you.
And then what about the actual testing itself?
The testing is a blood test. And after we've done the history gathering and the information giving, then if you decide you want to do the genetic testing, we go through a consent. A consent is signed, and then you have your blood drawn. We send it out to a lab, and within 3 weeks, the results usually come in.
Then what can I expect? Do I contact you? Do you contact me? What happens next?
Actually, at your first visit, we schedule the appointment to go over the results approximately 3 weeks from that visit. So that visit's already set. Then you just come in. I will have the results and will have prepared a plan based on your genetic testing results and your family history and what screening or what changes may need to be considered based on all the information we have.
I know one of the questions that many people would be asking is how much does genetic testing and counseling cost?
Genetic testing, I can speak for my process and what happens when I order genetic testing. Most people don't pay anything for genetic testing because most of the people that I see meet the criteria, the insurance company's guidelines for genetic testing. And if that's the case, most insurance companies will pay. If by some chance your insurance company doesn't pay, or if they have any exclusionary coverage, the test that I do costs $249 out of pocket. That number has come way down over the years. When I first started doing genetic testing in 2006, it cost $6,000 just to test the BRCA1 and BRCA2 genes. Now I do a 77 gene panel, and the most it can cost is $249.
That's quite a change.
That's almost 20 years advances in the technology, how to do the testing, and also competition between labs. So that's a good thing.
Once the genetic testing is complete, can that tell me if I will get cancer?
It will not tell you whether or not you will definitively get cancer. It tells us whether or not you have a risk, and the risks are given in percentages. So when we get the results of the genetic testing and there's a mutation in a gene, the lab gives us estimates of lifetime risk of cancer. So for example, someone with a mutation in a gene that gives a 30% lifetime risk of breast cancer, that's as specific as it gets. You can look at it in two ways. You can say, I have a 70% risk of not getting breast cancer. I have a 30% risk of getting breast cancer. I just can't tell you which side of those numbers you're on.
And on the opposite side, let's flip it around and say if the genetic testing is negative, does that mean that I won't get cancer?
No, that is not what that means. Most cancer is not due to a mutation in a gene. Most cancer is due to other factors like family history or environmental exposure, or a combination of those things, and other factors that we don't even know about. So an important part of the genetic counseling when someone is negative is making sure they understand that that result does not mean they'll never get cancer. It means we have to manage them based on their family history or their personal history if there's cancer. We also talk about modifying environmental exposure and other things like healthy diet and physical activity.
Got it. Is there anything else that you would like to mention about genetic testing, genetic counseling?
I want to make sure people understand that just because they may be referred for genetic counseling does not commit them to genetic testing. The genetic counseling is the information gathering to assess the indications for genetic testing. It's information gathered by the patient to make sure they want to have the genetic testing and that there's no commitment to have the blood drawn. My job is not to tell people you must have genetic testing. My job is to give them the information they need to make the decision. And then if they do make that decision, to help them through the process. And if they decide against genetic testing, that's okay too. That means I'm doing my job and I've given them information they needed to decide against the testing.
Okay, well, I think we have covered it. I appreciate your time and your expertise, and I look forward to talking to you again soon.
Thank you so much.
Be sure to check out our website, levercancercenter.org, for more great content and new podcasts. Content produced by Leever Cancer Conversations is for the community and is for education purposes only. We do not diagnose, treat, or offer patient advice. Thanks so much for listening.